to impact. So we will now begin session 5, titled From Insight to Impact, Research Collaboration to Promote Equity, Innovation, and Resilience. In this session, we'll explore how to transform yesterday's discussion into joint research priorities, shared platforms, and long-term partnerships. So please welcome our speakers, Dr. Nishant Jain, Senior Health Specialist, Human and Social Development Office, ADB Sectors Department, Asian Development Bank from Manila, Philippines. Dr. Ann Thow, Professor, Public Policy Health, Faculty of Medicine and Health, the University of Sydney. And Dr. Suwit Wibulpolprasert, Advisor to the National Commission on International Trade and Health Studies, Thailand. This session will be moderated by Dr. Piyarat Jiarpinitnun, Research in Public Health. Please welcome them on the stage.
Hello everyone, and welcome to section 5. And it's my great honor to be interviewed both of you and also Dr. Nishant from online. So from yesterday, we explored the importance of resilient supply chains and local manufacturing of health products and also the regional cooperation. So in today's section, we will build on those insights and discuss how the research cooperation can strengthen this linkage. And maybe we will show you the slide of the several potential research areas emerged from the discussion yesterday. So from the it's the key issues from session 1 to 4, and I will introduction a bit. So let's begin with the section 1. Okay, next slide, please. From the session 1 yesterday, we learning about the geopolitical challenge, the investment in the healthcare sector, investment as an enable for trade and health, and also the supply chain resilience in the regions, and also leadership role in regional cooperation. And for the session 2, we are improving innovation and access, as Dr. Suwit also present, and IP as the enable for the technology and innovation, and the government purchasing power to drive domestic innovation and lower the price, and we want to know how to do it effectively. And the section 3, next slide please. We know about the WHO pandemic agreement, the operation model between countries, region, and also the global level, and also the financial model and other operations for the technology transfer and local production and appropriate sharing benefit schemes as what is the affordable price in practice, and also monitoring and evaluation system for the pandemic agreement in countries level as Malaysian researcher presented. And for the section 4, we present about the regional cooperation as what is the topics, issue, and the region like Asian as we are should propose the create its own agenda for the mini-tourism in order to drive their agenda forward the global level, and also the regional cooperation and also experience sharing from regional perspective. So today I want the experts' comments about these questions. And Dr. Suwit, do you have any questions or any research issue that you want to raise up? So.
Very interesting question. And I don't have any. My question is, how? There's so many research, so many researchers, lots of money around. People always say that, oh, I cannot find money for research. That's not true. Those who hold money, they have difficulties. They are sitting on hot seat because their money come into their pot every year. And they have to spend the money. And they have to prove that this money that I spent worth, right? So I am I chair the evaluation board of the Thailand Science Research Innovation Fund. They have about 600 million US dollar a year. Every year, $600 million come in. Of course, it's not only for health. Their challenge is to prove that this 600 million US dollar bear fruits, improve the society, improve the economy. So it's us who are the worker, who are the mover, who are the academia, to prove to them that we have something to offer them, that to make their money worthwhile. That is our challenge. Do we have good enough researcher, committed researcher, to answer a relevant question? For example, the Trump tariff, how is it going to affect health? How is it going to affect universal health coverage? This is a big question. And we need systematic research. Money is there, but no one proposed so far. Many things that happen in the world, even climate change and health, commercial determinant of health, all these require research. Every year in Thailand we have an international conference, a global conference on global health policy. We call it Prince Mahidol Award Conference. Usually hold in January, end of January, every year for the last 18 years. And in 2027, the theme will be commercial determinant of health, which is very closely linked to our ITH. From today until then, do we have something to offer to that conference? Are we going to do some field research question, important research question together? Not only on health in Thailand, but on health in ASEAN, on health in Asia, on global health. If you look at the situation from the Trump administration, cutting down global health budget, not only Trump, EU and other rich countries cutting down. Many people out of job. I have to tell you frankly, I'm extremely happy to see that. I'm extremely happy. I used to work for the board of the Global Fund. I was the vice chair. I used to be executive board of the WHO. I used to do many things on global health. And I saw sad thing happen. They consume a lot of money, huge bureaucracy, lots of vested interest, and go nowhere. So Trump come in a very right time. And the EU decision to spend more money on defense come in at the very right time to reshape the whole world. And this requires lots and lots of research, not just very brand research question, but very, very sharp, very sharp, very hit to the point research question. I'll stop now.
Thank you, Dr. Suwit, for the comments. So maybe we will move to Professor Annie Marie Thow as she is the researcher. So I would like to ask which research topics are most critical to promote equity, innovation, and resilience to trade and health.
Thank you so much. And yeah, thank you for the invitation to be on this panel as well. I wanted to pick up on one of Dr. Suwit's points about relevance. And the first point I wanted to make in terms of this question about which research topics are most critical is that I think there's a bigger question about how we identify our research questions and how we begin our funding applications, as Dr. Suwit has talked about. And I would have three encouragements on that front. One is to listen better. I think we as researchers don't always listen to people making policy and people close to the policy space. And I think there's an opportunity for us to lean in on listening, to understand better, my second point, how we can ask the hard questions. I left government after a few years because I had questions that were very difficult to ask when I was working in government. And academia gave me a space to ask some of those harder questions, not that they're particularly complicated, questions about what works in terms of cross-sectoral policy engagement, right? But they're harder questions to ask when you're sitting in the government. And I think that's another opportunity for research, to ask the questions that are needed for policy making, but are difficult to ask from inside the institution. And the last opportunity I see is to really also lean in on our fundamental, I guess, mandate as researchers around learning. How do we learn from experience? There's, even in this room, a wealth of experience, and some of that is passed on and some of that gets lost. And I think that we have a huge opportunity as researchers to learn from past experience and to use that to cast a vision, to use that to think about what it would look like to do things better and more transformatively, if I can use that word without it being a cliche, in the future, particularly when we are in such a state of flux. And we've talked a lot about the negatives of the current context for research, but I also see some positives. I think we have now a new recognition globally of the intersection between trade and health. I think this is not new, but I think it's a new level. I think there's an increased understanding that these two sectors do really have implications for each other, and that decision making can be different in both sectors. I think we also have a better understanding of how vital human health is to achieving sustainable development. COVID-19 really drove that home. And finally, I think we also now, and in many thanks, I think this is a testament to the work of the Thai government and to this conference, we have a new level of capacity to do research at the interface between trade and public health now. I think that's built steadily over the past 15 years. But when I started working in this space in 2007, it wasn't really a thing. There were a handful of people globally who were interested in this space. And now I see a huge change, and I think this is really exciting to have new perspectives and to have multidisciplinary approaches. In terms of what's important in terms of research, I want to highlight that we heard a lot yesterday about the need for evidence to inform policy, so new and different policy in the space. So for example, Dr. Matthias had a big list of questions that are kind of technical questions. How do we make better policy? What do we need to know to make good policy in this space about technical issues? Questions like, How do we strengthen access to medicines? How do we improve vaccine development, pandemic preparedness? How do we guide public procurement? These are important questions, and I think they require technical answers and research to answer that. I would encourage us, though, to not just ask technical questions, even though we need that and it's very important. I think we also need to generate research evidence about policy design and policy strategy. So questions that were raised yesterday that I think speak to this are questions about how do we use TRIPS flexibilities better? What should ASEAN propose as a mini-lateral agenda? And what have we learned from experience in our region about how regional convergence could strengthen access to medicines? So those how questions for policy, I think, are also really critical. Thank you so much.
Okay, thank you, Professor Annie Marie. So next, we will ask about the funding perspective as the Dr. Nishant Jain from Asian Development Bank's perspective. So I would like to ask you about which research themes are the most likely to affect funding, especially in our region countries less low to middle income countries. So do you have any comments or any idea about affected funding for us? Can you hear me?
Thank you very much.
Okay.
Yeah, good morning, and thanks for inviting me for this conference. We are very happy to be here. Unfortunately, could not be there in person, but still, and it's always nice to hear Dr. Suwit speaking. He speaks from heart. So, I think, as he said, money is not the issue in research right now. There is money available with the government, as he mentioned, with the development partners. But I think the issue here also is that how do we identify the topics which resonate with the policymakers? Many times we see research is done for publication, for the sake of research. You will see very nice research, very rigorous, and with the best methodology, but that may not help anybody in terms of policy making or in terms of implementation. So, and which has its own value, of course. But from our perspective, when we look towards research, I think we look towards research which is more applied, which can be then used in real world, either by the government in policy design, redesign of policies, change in course, or in terms of improving the implementation. So I think for us, very important thing is to look at the usability of the policy. At the same time, the research should also be acceptable. In this, when I say acceptable, means that the government or whoever is the target audience, they should be open to listen to research. Like I know many countries or many places where the policy making is not with research and not with data. It's intuitive. But in many other places, they look towards research, they look towards evidence generation for policy making, which is very good. But at the same time, often we also see that the policy making many times have to be done very quick. So you need quick answers. You need quick, not a research which takes 3 years to do something which the government has to do in 1 year, for example. So I think that how do we match between what is the requirement from the policymakers and what are the limitations which researchers face? I think this overlap and this alignment is very important. That is second point. And I think also what the other colleague mentioned regarding having a better pool of researchers now, I think that is certainly the case, where over past decade or so now we have more researchers available. So how do we actually make them also better aware? Because as you were saying, listening. So of course, listening will help very much, but also somebody should speak loud enough so that they can listen. So in that sense also, I think government also has a role to find ways in which they can also make their requirements heard by the researchers. And sometimes in some countries like Thailand, there is good relationship between research community and the government. Not in every country, but Thailand is a good example there. So I think that kind of system is very important. COVID had shown that the regional level research is also very important. It's not only country level research. So when we talk about human resource for health or universal health coverage or many of these topics, we look towards also that what are the regional implications now? Because we have seen that the medicines or the diseases, they don't see any boundary which have been drawn by humans. So in that sense, I think how do we leverage the regional mechanisms? How do we leverage ways in which research can feed into policy or learning from one region or one country to another? That is also very important. So in terms of topic, I feel we will feel that, of course, different aspects of universal health coverage still remains very relevant. COVID has shown that countries with stronger UHC were able to cope better, at least, and also then bounce back better. So that way, I think it's very important to have more, a lot of ideas going into there. But within that, it's such a huge domain, which topics to focus on and all that is needed to be seen. Second is human resource for health, I think is again very important because we are seeing how human resources are so critical. And when I say it does not mean only doctors and nurses, but all kind of staff which are working in health sector. I think how do we actually see that they move beyond borders, they're accessible because some countries may produce more, some may produce less. So how do we balance that? What is the best mechanism for that? Third, I think technology is becoming very, very important. Now this AI coming in and a lot of things which AI can do, lot of things which AI may not be able to do. How do we define what is to be done by them and what is not? How do we actually draw the boundary where what is relevant or not? So I think that research related to digital health also will be very important and what role it can play. So of course it is playing very important role, but how do we give it a better structure in terms of using it in the health sector and then converging with other sectors? Because as we have seen, that the linkage with other sectors becomes so important and often health, though it is linked very well in terms of policy or in terms of research, it generally keeps itself limited to health sector related things. So I think time has come, or maybe time had come earlier itself, that we go beyond, we go intersectoral. I think that will be very important. And I was so happy to hear 27 PMAC theme of commercial determinants of health because it's not talked about well enough. So I think that will be very good to see. But stop here. Thank you.
Thank you so much, Dr. Nishant. So you mentioned about the multi-sector. So I would like to ask from the policymaker's perspective that what strategy to prove the effective for multi-sector cooperation that can inform policy? Can you give an example?
We are the example. Dr. Sampan chaired the NCITHS, National Committee for International Trade and Health in Thailand. We have this mechanism for more than 10 years with 2 chairs, both of them from private sector, senior private sector people who have the heart for the public. You find them, they are everywhere. And it's multi-sectoral, public, private, academia, NGO. Kun Jockey there, sit there. NGO, very strong NGO, also sit on that committee. In the discussion, there are so many demands for evidence to support the decision. That committee was appointed by the Prime Minister, who chaired the National Health Committee. I look at Ms. Supak there. She represents Thailand to negotiate for the pandemic agreement. I'm sure through the process of negotiation, she has many questions. She has to negotiate without enough evidence. What should we do with technology transfer? What would be the best for our country? How the pandemic agreement can ensure access to essential VTDs, vaccine, treatment, and drugs. Actually, for me, I don't care at all. Look at the COVID as an example. What you need is what? hand washing, distancing, right? Distancing, hand washing. No cost at all. Put face mask. Why do we have to wait for vaccine? You have the immediate vaccine there, right? But she has to discuss a lot, days and nights in Geneva for something else, vaccine, treatment and drug. What evidence we can give her? She would be the best person to ask, to give us the research question. Kun Chokki is watching very carefully what Thai government is going to discuss and agree on FTA with the US, FTA with the EU, FTA with Canada. Tomorrow they are going to convene a meeting, Thai-Canadian free trade agreement. They're watching very carefully how will it affect access to medicine. They have lots of research questions. That's very practical. Ambassador Pim Chanok back there, she negotiated at the WTO all the time. She must have many questions that she doesn't have evidence to back her up to negotiate, to achieve the goal of the country. This is not only Thailand, but every country the same. How can ASEAN work together to deal with Trump tariff? This is another big question. It's political economy question. It's not technical, usual technical question. How many political economists, how many political scientists we have involved in doing all this research? Geopolitics, as Mark has nicely presented to us yesterday, this needs research as well. We cannot focus only on technical things. Ask them. If you go to ask the policy maker, if you go to ask the prime minister, the minister, or the DG, you never have research question from them. We have did that before. They come up with something lousy because they have so many day-to-day jobs. It's their advisor. It's the policy advocate. It's the policy broker who can give us the research question because they are the one who advise the minister. They are the one who advise the prime minister. They are the one who advise policy maker. And all of us are policy maker one day or another. One day I happened to be appointed as the chair of the National Essential Drug List Committee by, by fate. I have so many questions. Which drug I should put on to the list? If I put it on the list, it means every Thai citizen will have it, free of charge. Lots of money involved. What evidence that can help me to make the decision, right? So finally, we end up creating a program called Health Technology Assessment Program. They have the question from us. They do research. They inform us. This will be the best way to make decision. So we must work together. Research question must not be supply side driven. It must be demand side driven. Or at least demand and supply talk.
Thank you, Dr. Suwit. So we mentioned a lot about the Thai budget as Trump policy or something. I would like to ask researcher, how can we rethink the partnership or leverage aesthetic data to continue generating insight even in the field resource or Thai budget? What your opinion about this?
Thanks so much. Following the really excellent comments by Dr. Suwit, I wanted to pick up on the commercial determinants of health and the need for political economy research, because I think this is something that we touched on yesterday, but we didn't deep dive into. And one of the things that was really evident to me yesterday is that sometimes the public and the private interest have a lot of alignment and a lot of synergy. And in that case, we see opportunities to leverage private interest for public good and to improve healthcare provisioning. I think Anthony gave a great example of hospitals working together to support not-for-profit pharmaceutical industry in certain ways, right, which is a great example of this. I think where we see some really significant political economy challenges is where the private and the public interests have some misalignment. And this, I think, is it excellent that this will be discussed at the Prince Mahidol conference in a year and a half. But I think this is an area where rethinking partnerships requires engaging with those instances where the private and the public interest don't align well. And I think some of the preventive health issues that were discussed yesterday highlighted this. So issues related to alcohol, tobacco and food in particular, where we see some misalignment between large private sector interests and the public interests, where we do want to see people reduce consumption. And legislating to reduce consumption will impact on trade and will impact on investors. And this is both an area of research and I think a critical element to rethinking partnerships and to creating some safeguards around partnerships that make those interests visible, both where they are in alignment and where there is a misalignment. I also wanted to touch on the use of AI in this context around leveraging existing data. There are many, many sources of existing data which I think are underutilised. I've just finished a large multidisciplinary project working with lawyers and data scientists as a political economist myself, and then also with public health specialists on understanding health safeguards in investment treaties. And we used the new newish now, EDIT database, which has the text of every single investment treaty which has been signed, right? That's a fantastic resource. UNCTAD has a huge database of non-tariff measures, which they've compiled manually, but there's an opportunity to look at these large data sources using AI. And I think I have a lot of reservations about this, but I've also just finished a small pilot project looking at the potential for a closed artificial intelligence platform to inform policy making at the interface of trade and nutrition. And this is something that I'm excited about because I think that in this space, we often, at that interface between trade and public health, it's often hard to access information when you're not sure as a policymaker what questions you should be asking. And having experts is fantastic, but sometimes that's a luxury. And I think there's a lot of very talented policymakers out there where improving equitable access to the type of discussion that we're having today and yesterday would be really valuable. And I'm not convinced, to be honest, that AI is the answer, but it was fascinating for us as a team working with data scientists to be able to set up a platform where you could have an interactive conversation to ask about, for example, what are the trade considerations of changing my nutrition labelling policy? To be able to go into policy making informed and to use that as a starting point to then have conversations with counterparts in trade, and of course vice versa. So I think there's an underexplored opportunity in rethinking the way that we do research. When we discussed this with UNCTAD and the World Trade Organization colleagues and FAO and WHO around, what it would look like to use this type of technology to support policy making, it was really interesting to also hear them talk about the data sets they have. So WTO, of course, makes all their meeting minutes public from all of their committee meetings, which is in itself a source of data about the political economic considerations. And FAO similarly has huge quantitative data on flows. So yeah, I'd like to put that forward. I'm happy to talk more about that. later, but I think there's an opportunity. Thank you so much.
So thank you for the answers. So
I suggest to her that instead of going to Nishant, it's like a first round, second round, right? We should ask those who are negotiators in this room on international trade, what question you have in your work. I see Kun Sampan. He negotiates every day in his business. Some of them dealing with health, of course. Ambassador Pim Chanok, Kun Sukpak, Kun Jokki. These are the people who should provide us with some insight on what we should do on research. I'm not sure, Nishant, you negotiate anything. Of course, Nishant, you negotiate for the loans, right? You negotiate for the loans that the bank will give to the country. And with that loans, they usually come up with conditions. Structural adjustment program. You have to decentralize your health system. You have to reduce the role of the government. You have to allow more private sector. This and that. Artists have evidence to support that it will make healthcare system better. We should ask him when he, give the loans, what evidence he have in hand or he want to decide on giving the loans that will be good for health.
So if any participant that Ajahn mentioned have any questions, please stand up to the microphone and we will welcome.
Hello. Okay. Thank you, Dr. Suwit, that mentioned about the role of civil society. I don't have the research question to suggest, but I would like to mention about what the challenge that we are facing about how to make use of research. Many research has been invested a lot, but has put on the shelf. No one uses it. But on my experience, I think the research is a good tools for us to advocate for change. Like, for example, about FDA, about the patent and access to medicine. I have to accept that civil society had make use of the research to simplify it and discuss to our civil society groups, with the patients, with the people living with AIDS, what is the application of the FDA, what the application of the patent have impact to access to medicine at affordable price. So it is a challenge there for the research to formulate the question. That's one thing. But another thing is how to make use of that research, how to communicate with the civil society, with the public to understand why the research is important, what is the result of the research can be used. And then it's like we work together on the research side. Now we produce the research and use it to introduce or make the presentation to the policymaker. On the other hand, civil society, public also use the research as well to communicate with policymaker. This is going to impact going to happen. We have to avoid that kind of tip plus provision in FDA negotiation, something like that. And I would like to mention about some couple examples that we have used, particularly on the evergreen patent. We use it a lot. And we produce like the animation and produce many the communication material to communicate with the public, communicate with the patient, or even at the international level. They use this kind of result of research to replicate similar animation in English. And they not just dispute it in other countries as well. So it's a trigger to make those civil society in that country to look at what is the patent system in your country, how much evergreen patent happen in your country, how much money is spent for the low quality patent on medicine. So it's like to stimulate this kind of eagerness to know about this kind of application of the patent, or even another research under the IHPP about the impact of the FDA, particularly on US or even the EU, to access to medicine. So it's quite very clear that we have a very negative impact on that, and how we can negotiate to mitigate or minimize the negative impact to access to medicine. So I would like to mention about that in addition to what is the question for the research, but how to make use of research to make change happen. Thank you.
Thank you so much. So next is Dr. Supak. Okay.
I'm sorry. Well, it's good that we're fighting over the mic. I'm not sure whether these questions will sound quite laughable to you, because in the end, I'm not from the public health background. And therefore, when I was in the room, Dr. Suwit is absolutely right. We have lots of questions as we were sitting there in the negotiation rooms, especially because half the room is not from public health backgrounds. A lot of them are diplomats like me. So we want to know a lot of how things practically work, especially how the VTDs are produced, manufactured, how they actually come into physical, practical work, basically. Like how do you get from pathogen ideas, data, to the end results of the VTDs? We have lots of expert answers on that already during the negotiation, but because it's a very limited time that you can consult with them during negotiation, you only get snippets of it. So that's one, and I'm sure that's a huge areas of research that you can do. Secondly, this is not just Thailand, but everyone's pretty clueless about the databases technology right now. How is it that how do scientific research actually can be conducted using these databases, and what practicality, like the practical ideas of how the scientists actually use those databases, how do they talk together? What is the exact science of it? We get so many experts coming in to talk about these things, but they all have ulterior motive. We can see that. They all want to tout their trade, if you like. My models is the best. This is how you use it, because that's how they make money, I'm sure. But we also want to know how Thailand does it. How do we share pathogen at the moment? How do we share data? Those ones are the big ones that we're looking at right now, we're negotiating right now, and we really have no clue. And it's not just about the MOPH, but also you need to work with other ministries as well, to get the overall picture, to get the complete information. So another maybe a little caveat for future work. It doesn't work if you just sit with the MOPH and talk with MOPH. It doesn't work. It doesn't work if you just isolate yourself and talk with just Department of International Organization or anything like that. It has to be, it sounds very cliche, but it has to be a collaboration between many different agencies for us to have a workable, a usable information to really negotiate in that fora. So that's a little thoughts from me. Thank you.
Thank you. So I'm totally agree with you. So yeah, as people say that said is easier than doing. Yeah, right. And so the next.
So we have been all summoned by Dr. Suwit to come and share our thoughts. I would like to talk about the impact of President Trump's policy on Thailand and maybe ASEAN. It is correct, as Dr. Suwit has pointed out, that we need analysis of the U.S. Current policy. But I have been trying to get the analysis before I came here, because I do have access to many research and global research facilities, because my ministry subscribes to all those services, but apparently nothing can be done yet to give us the full picture at the moment, because President Trump's policy is quite unpredictable. He changes his mind every day. You know, yesterday or the day before, he announced a 100% tariff on pharmaceutical products, but he hasn't followed through. So we can only anticipate whether this will become real or not. But I think at the moment I can share with you, Dr. Suwit, as well as all the other participants, that analysis on the potential impact of goods are available, but not specifically to Thailand or even ASEAN. But that's like, let's say, what sectors are going to be mostly affected by the U.S. policy, and who is having more leverage than others. You know, this kind of stuff is done. Even in Geneva, we have Swiss research faculty, the Global Trade Alert of Professor Simon Ivenet and his team are doing this all the time. So I have the picture of the impact on the trade in goods mostly. But what I'm seeing is that Trump's policy will not only affect the flow of trade in goods. More importantly, in the future, it will affect investment, like you said, because when all these negotiations or the deals are done, then we will see which country will get how many % of reciprocal tariff rates. And then the investors, they will have to adjust their investment destination, taking into account the potential trade policy with China, with Canada, with Mexico, with everybody, you know, and they have to decide on where is a safe haven for future investment, including in pharmaceutical sectors. So I think the first impact we will see is that there will be trade diversion impact from the tariff rate, but and also because of the rules of origin. I think this is also, we don't know yet. No country has concluded negotiations with the U.S. on transshipment because they still, I think maybe they don't have quite decided yet what kind of rules will be applied on each country. The purpose of transshipment clause is to prevent trade with China, for to use us in Asia and other countries as the backdoor. That is the U.S. ideas, but they have not decided on what is the proper mechanism, what are the procedures, or even the rate of punishment. I think the rate has been put at 40 to 50. If you have products that are deemed being transshipped, then you will suffer the rate of minimum 40%. That's the idea. But procedures and calculation are not yet decided. So from tariff and rules of origin, then you will see the different flow of investment taking place after that, because investors try to avoid diverse the risk. And then we will see better, clearer picture of what are the impact of Trump's policy. And then after that, of course, apart from this trade, we have a problem on Trump on SDG. He has cut down. He has told his government in Geneva not to support any SDG project in the organizations that I cover. So it will have impact on development. It will have impact on researchers. It will have impact on how government help with access to drugs in poorer countries, and also many other ramifications. For example, on climate change, this has also been quite severely affected by this. Not to mention the funding, I don't have to mention about that. So but I'm just gonna wrap up here. And I said, when I took a long read of President Trump policy before I came, and actually they are quite strategic. There are still about 5-6 sectors in the pipeline of being attacked. So that is where we have to focus on in the future as well. Not one of them specifically on the pharma. Pharma is one of them, but it's early target. But there are others as well, like solar panel and other things. They are taking measures on strategic sectors. So I don't think their action is clueless. It's not. They are very strategic. So we have to think strategically as well. That's what I would say at this stage. But I think, so sorry to take up such a long time. Thank you very much.
So thank you for the valuable insights. And from the floor, yes. I think.
Thank you, moderator. I think recently I observed two things that I don't like. That a lot of KPI in many organizations just measure heavily on the quantity of research. I think we need to balance between the quality and quantity of research. Number two, we have to be careful when we are using AI in the research. To be more ethical to the researcher, let identify that the whole research content that this portion that you put heavily from AI and the other part from non-AI. I see a lot of professors in university try to charge to the number in terms of quantity because I think she got some motivation in those quantity of research. And at the same time, you see 90-95% purely from AI. So those are the two cents that I want to add.
Okay, thank you for the quantity and quality issues that you raised. So any comments from the floor?
I want to ask Nishant. When you give loans, ADB give loans, they are the bank. Their business is to give loans. Am I correct?
Of course.
Yeah, your business is to give loans. If you cannot give loans, you lose your business. But you want your loans to be productive. What question you need to make sure that your loans will be productive, will improve the health of the people, and especially about access to medicine and trade.
Thank you, Dr. Suwit. Now, this is a very important question because not every loan request which comes to ADB is also agreed by ADB, because we also see that whether the money will be achieving development results or not. So in that perspective, I think for us also it's very important to discuss with the government before we agree on a loan is to see what will be the impact. So for example, just to give you an example so that it's much more easy. We got a request from one of the places where they said that, oh, we want to set up 5 medical colleges and teaching hospitals, please give us loan. Because ADB is more infrastructure, people feel that, okay, take the loan to build more buildings. But then when we discussed, we said, see, these places are in remote areas. You don't have doctors and the staff. How will they go there? So they said, yeah, that's another problem. We'll have to find separate solution. Then we said, why don't we first discuss this part also so that the loan can also help with that. Then we discussed that what kind of policy level reforms would be required if you want to make, let's suppose, new human resource policy, new policy for asset management of new things which you create. So then we discussed with them, we said, okay, we agree on the loan, which will be a mix of policy reforms and a mix of investment, so that it will actually serve both the purposes. And the policy reform will not only help these particular 5 locations, but that can help actually across wherever there are these medical colleges are already functioning also, so that you have incentives, you have various things which were discussed in the policy reform. But it's not that these reforms were coming from ADB. These reforms, as Dr. Suwit said, we also try to see that what are the evidence for these reforms working in other countries, in other contexts, because then only you can work on these reforms, rather than saying that, okay, ADB has some very fancy idea and why don't countries implement it? So I think it's a mix. We try to see what has worked in other contexts, what kind of reforms have worked better. At the same time, I strongly believe that whatever loan we do, we should have a very strong evaluation component to see how it is working and how it has worked. What part of the loan actually worked as envisaged and what didn't. Because then only we can learn for the future loans. Otherwise, we will just keep thinking that, okay, we have given the loan and now our job is over. But then the job just starts once the loan is approved, because then you have to see whether it is achieving its development objectives or not, whether it's improving, for example, access to medicine, whether it's improving access to human resources, access to health. All these things we need to see, and then only actually it can work better. So yes, so we try to see, but I think there is much more scope to bring more interesting research in this. And as Dr. Suwit, you know that we recently have started trying to work on this peer-to-peer learning across countries. And that's where also we are looking at researchers to be very strong part of it, so that more evidence can be generated, not only for ADB, but for the government itself. Thank you.
Nishant, I'm sorry I couldn't join your peer-to-peer in Manila.
Yeah, I know, but we'll do in PMAC one more sessions, then you will join.
Good.
So, yeah.
Thanks so much for all the comments from the floor. That was really helpful and really interesting. I wanted to just make, just add a few reflections on the role of research, because I think that, as described, research can play a really important role in making the problems that we face visible, and to understand better what the nature of the problems are and who they're a problem for, bringing it back to this issue of equity in particular. And that research can also help us to understand potential solutions, what the technical aspects of those solutions are, who can take action on those solutions, but also how we can translate the vision, as the ambassador noted, into reality. And I think Dr. Sukpuk also highlighted this. How do we go from having a beautiful aspiration to something that comes out as we want it to in the real world? And I think research can also highlight how to set priorities in a context of always limited resources. But I also wanted to highlight a couple of other aspects. I think research can play an important role in asking questions that no one is asking. That idea of blue sky research. I think all of the conversations that we're having now about the massive changes that are occurring in both trade and health are important, but they're also happening in the context of a global economic system that has not really been delivering economically or environmentally or socially or for health for a number of years. I think, following the large shifts we saw in the approach to economic development in the 80s and the 90s, we've rethought some of this, but we're still seeing real challenges in achieving the Sustainable Development Goals, which I think have fundamental systemic roots. And I think research can play an important role in digging into some of those roots and asking bigger questions that aren't on anybody's agenda about what it looks like to revision how we kind of do society moving forward. And this, I think, is what I see as an opportunity in the current chaos, that actually maybe this can prompt some completely different ways of thinking about how we do structure economies and how we do economic policy. And I realise that's a big ask, but I do think this is what's needed, that sometimes when we just do responsive research, we risk just tweaking the status quo rather than taking a big step back and asking some more fundamental questions. And I also wanted to highlight that I think this is, I'm a huge believer in evidence-based policy making, but I also think there's a risk to that, in that if all of our decisions are evidence-based, we won't be able to innovate. If we're always basing it on things that have happened before and have been evaluated and we know work, we're not going to try anything new, because there isn't going to be evidence for doing new and totally different approaches to policy. And quite frankly, I think we need those new and totally different approaches to policy. And so the challenge for us as researchers then becomes, how do we generate evidence that gives us insights and wisdom about those totally new, different approaches and not just, tweaking the status quo?
Thank you, Dr. Thow, for the comments. So we still have allowed like 10 minutes. So I would like to ask about the platform or mechanisms. Start with the Dr. Nishant. So for the regional financing and system perspective, which funding mechanism could support cooperation in our regions? Please.
Thank you. When you say funding mechanism, what do you mean?
As for the research funding.
For the research. Okay. No, I think that research funding a lot comes from either the government or the banks or from other organizations in terms of grant, in terms of through the technical assistance support. That comes out strongly. But also going forward, we are also trying to build some kind of research component even in the loan itself. Because if you need to do evidence generation, if you need to see effectiveness of the impact of the loan, then you need to have a fund to actually do that. And that's where I think it's very important that we are able to find money not only through the TA and grant, but also through the loan component. So in some of our recent loans, we have built a research component itself for the concurrent evaluation of the loans, for the concurrent evaluation of the impact, and then see that how that fund can be used. But at the same time, I feel that we need to have also some kind of more systematic way to fund research, not only through specific loan, specific grant, because that is linked to a particular project. But I think there are some research activities which are beyond a project, or a lot of research activities are at a larger level, at the country or a regional level, where evidence can be generated which could be useful for many. So I think that from our side also we are trying to find ways in which we can fund research and related activities through various other mechanisms, which are like some kind of funds which can be there to help the countries, to help the researchers, to not only to find the topics, but also then to fund that research and then also to disseminate it. So we feel personally that yes, we need to have some dedicated funds in addition to the existing ways in which we are doing it. Thank you.
Okay, thank you. So,
Nishant, you have raised a very important question. Evaluation after the deal, loans or FTA, whatever. Once you have the deal, usually there is no evaluation. Whether what you expect to get, you really get or not. When we start to negotiate for FTA, our trade ministry usually contract economists to do research on the potential economic impact of this FTA. If we agree, if we have the deal, this FTA will help improve such and such percentage of our economy. But after we have the deal, we have never seen any evaluation of whether that really happened or not. At the same time, the NGO or the academia came with the argument that if you enter into that deal, you lose this and that. And after the deal, we never see the real evaluation on whether we lose or not. Except one that I have seen. When we implement the compulsory licensing or government use of patents on 7 medicines, those who oppose argue that the US will retaliate on us and will lose such and such and such of our export. And they did retaliate. Reduce the GSP or cut the GSP. GSP is a unilateral trade system, unilateral decision system. They cut the GSP of 3 products. We are lucky to have Dr. Intila. She sits there at the back. She volunteered to do the research. After implementation of compulsory licensing and after the retaliation, she found no reduction in export to the US of these 3 products. What she found is that the industry learned to adapt, to find new markets, and finally, at the end, the export of these 3 products increased, not drop in the US, but increase in other markets. So we need a lot of this kind of evaluation research that Nishant mentioned. I am very glad to hear that now you have the research component in your loans. Usually we have to ask for the grant for the research component. Now it's in the loan, which is responsible of the country that deal with the World Bank to evaluate the implication of the loans that they get from the bank.
Thank you, Dr. Suwit. So we have a few minutes. I want you to give the key message for the audience and online. So I would like to know about the sustained cooperation. Do you have any comments? Yeah. And from the floor also. Or you have any questions, you can come to the mic and ask our experts to answer.
Thank you. I don't have I'm not going to respond to your particular question, but I have one observation based on what I have been working on international trade and health area. One thing is that maybe Emery can give me some example on how to improve. It's quite difficult to attract researchers who like to work in the area of international trade and health, particularly in Thailand. We may have a group of researchers who are interested to work in access to medicine area in particular, the IP protection in particular. But for those who would be interested in working on the issue of international trade and health in a wider picture, and those who can be interested in catching up with the changing situation which is happening quite rapidly. From my experience, I see that is one big limitation for us in Thailand. So if the participants in this room or the speakers can provide any additional comments on that, because even when we have research questions, we have funding, but we don't have researchers who are dedicated to do the work. That is also a limitation. Thank you.
Yes. Yes. So you have any questions?
This is a really good question, Cha-Aim, and it's not just you in Thailand. I think one of the challenges, actually, I think Dr. Sukpuk highlighted this as a negotiator, is that when you work in an area that spans multiple sectors, one can never feel like an expert all the time. And I think this is perhaps a particular problem for researchers whose sort of job is about being an expert. And I think this makes it challenging to work in a cross-disciplinary space. One of the senior colleagues in our field said to me early on that he considered himself a bad political scientist because, he was a full professor at that point, so clearly not bad at his job, but he said, look, for most people, they need to be across one literature and they're an expert in their particular topic. Whereas if you work in a space like the interface between trade and health, there are at least 3. There's the health literature, the trade literature, and then the political science policy literature. And that's huge. And then you also need to be able to respect and engage with people who have very different disciplinary expertise. So I've worked a lot, for example, in collaboration with legal researchers, which has been really fantastic. And there's been at least 8 specific legal researchers who I've found very generous in working with someone who's not a lawyer. And, that kind of collaboration can be challenging, I think, for academics. And so I want to encourage you in that it is genuinely challenging to cultivate a research collaboration and a team that involves people being able to define their area of expertise and also recognise and celebrate the contribution that people with very different disciplinary training and expertise make. And that, I think, is our opportunity to, and I think in line with one of Dr. Suwit's points earlier, to also make even more visible the way that researching at this cross-disciplinary space fulfills a very real need of the policy communities. And one of the things that I've found can really help, and I think you do this as well, is to create advisory groups that bring together the policy community, to have colleagues with trade expertise, colleagues with health expertise, colleagues with policy administration expertise, colleagues with legal expertise. And one thing that's done in my projects is to be able to have almost like a cheerleading squad of people who are saying, look, I want your research results. This matters, and what you do is actually helping us. And so I guess that's also an encouragement to the policy community in this room to be part of those types of advisory groups, because that, particularly for junior researchers, gives them a sense that the work that they're doing does contribute. And it also helps them to be better researchers. By listening to that diverse policy community, they can ask better questions. So I'll leave it there. Thank you.
I just want to add one point. The person that can answer Dr. Chaem's question best is herself. When we move on medical tourism, lots of questions that it will affect, negative effect on healthcare system, because you bring in foreign patients, they will suck in medical doctors and nurses to serve these people. And her research back in 2006 or 7 found that even though we are very successful, there will be a demand for just 10% of doctor full-time equivalent. If you ask me as a physician, if I have to work 10% more and I earn 3 times of my salary, I wouldn't say anything. I would go ahead and do it for sure. The second person, Dr. Intira, she did the research on to evaluate the impact of export of the compulsory licensing. After that, she stopped. Chaem also stopped. Dr. Suriwan over there, she did her research, PhD thesis on the policy process, political economy of ITH in Thailand. After she finished that, she stopped. So they are the one who answered the question, why? Why don't they move on? Why don't they continue to do it? It's a pity, right? They should not ask other people, they should ask themselves.
So, thank you, all experts. Maybe it's time if participants wish to continue discussion about this issue. So we have the coffee break after this. So thank you for our section, and I hope that we carry forward this idea and translate them into the meaningful impact to our region, country, and communities in the future. So thank you so much.
Thank you, Nishant.
Thank you.
And see you in PMAC.
See you in PMAC. Thank you.